I'm not going to touch Social Security, Medicare, Medicaid. None of that stuff is going to be touched.
Nothing.
You don't have to. Here's what I want on Medicaid. We're not touching anything. We're not going to touch it. And I'm not going to cut Medicare or Medicaid. Save Medicare, Medicaid, and Social Security without cuts. They're going to destroy our health care, but I'm going to save it all, and I'm going to save our country. That's what we're going to do.
What happens if it comes to your desk, has the tax cuts, but also cuts to Medicaid? Would you veto that?
Well, we're not doing that.
Would you veto
that? I would.
Yeas are 218, the nays are 214. The motion is adopted.
Billboard outside a rural Missouri health center is turning heads, blaming President Trump for its sudden closure. Take a look. The Silex Wellness Center recently announced it is shutting down right as President Trump signed a sweeping GOP budget bill that slashes billions from Medicaid. Now, Missouri Senator Josh Hawley voted for the bill, but now he says he's trying to reverse parts of it, pushing a new plan to double funding for rural hospitals. But health experts warn that relief might come too late as more rural communities brace for cuts and for closure.
We were there as workers covered the emergency room signs at Midcoast Medical Center in Trinity, Texas. The sight of medical workers leaving for the last time, signaling this is one of the latest rural hospitals to shut its doors.
I think how sad it is.
Marjorie Polvino runs the hospital board.
It has a huge impact on the committee. We will lose lives. 400 people a month come here.
Children's Hospital Los Angeles just laid off 437 employees. That includes bedside staff, therapists, case managers, and other non-clinical roles across almost every department. The layoffs go into effect October 28th, and CHLA says staff will still receive pay, benefits, and severance in the meantime. But here's what's not being said directly. CHLA leadership blamed growing financial challenges, but didn't exactly specify what those challenges are. And so here's the context. Their Sabin Research Institute is among the top 10 pediatric research centers funded by the NIH. But since Trump was reelected, NIH budgets have faced serious political pressure. At the same time, this administration also signed the One Big Beautiful Bill Act on July 4th, which includes hundreds of billions of dollars in Medicaid cuts. A pediatric critical care physician who wrote in Stat News already warned that this law could devastate children's hospitals.
We have some big news right now. Rural hospitals in Virginia are set to close soon because of Donald Trump's big budget bill. According to the Augusta Medical Center, 3 rural hospitals in rural Virginia will soon be consolidated as a result of the impacts of the bill. Virginia is set to lose $29+ billion in Medicaid funding as a result of the budget bill that was passed and signed into law earlier this year. And we're now seeing the impacts. We're seeing the impacts with rural hospitals closing. This is just the beginning. We're going to see more rural hospitals closing, not just in Virginia, but across the country. We're going to see more people lose access to healthcare, more people lose access to Medicaid. This is just the beginning.
The rural health care crisis here in Oklahoma has hit a breaking point this week. The town of Clinton, Oklahoma is having to give its local hospital $200,000. The city itself is having to give the hospital that money to keep it from shutting its doors. The hospital was about to not make payroll this week. It's all after the hospital, these rural hospitals have never really been profitable because just by their very nature, they don't serve that many patients. And this hospital was trying to sell to a private company that would have been able to buy it and operate it without having to shut it down because they could move money from their other hospitals where they do make money to this Clinton hospital to keep it going. But that sale fell through this week. And what's interesting is that this all kind of ties in with the uncertainty we're seeing over rural healthcare right now. With the cuts we're seeing to Medicare and Medicaid, rural hospitals don't really know if they're going to have that income flow to survive moving forward. And companies that might be thinking about buying them are now kind of getting cold feet on, is this something that we can really afford with these cuts coming to Medicare and Medicaid? 28 of the 71 rural hospitals in this state are in danger, critical danger of shutting down by the end of the year.
So I am a doctor and I was just let go, and my chief said verbatim that it was directly due to the big beautiful bill, due to the prospective budget cuts, or to the budget cuts, the expected budget cuts to Medicare and Medicaid. So yeah, I feel very vulnerable right now. And it's like, I didn't know, it's like I didn't know it could happen to me until it happened to me. So yeah, Trump sucks. But I'm gonna cry, and then after that, hopefully I'll be okay. Um, but yeah, update.
Today is a little serious for me. You can officially say that you know or you have seen someone who no longer has health insurance. My Medicaid was cut off after 15 years of being on Medicaid. I no longer qualify, according to the administration. I require for my life medications. I take 23 pills a day. From about a dozen medications. My total bill, if I were to buy them myself, which I can't afford to do, but it's $1,168 a month for my medications. I am not going to be able to afford that. I just afforded what I could. I got 7 medications out of 12. I can't buy the other ones. Some of them are just way out of touch. There's nothing I can do about it. There's no one to reapply to. There's no one to complain to. There's really, I'm shit out of luck, basically.
Okay, so we need to talk about something that is honestly wild, shocking, and heartbreaking all at the same time. Hospitals, clinics, even nursing homes in the US are literally shutting down or straight up turning away patients because of Medicaid cuts tied to the so-called big, beautiful bill. You know the one that was promised to fix healthcare and save money. Well, turns out a lot of people are being left out in the cold, and today we are going to dive into the reality of what that looks like. So picture this. Small rural hospitals that were already hanging by a thread, gone. Nursing homes that used to be safety nets for the elderly and disabled, packed up. Clinics that serve low-income families, doors locked. And the crazy part, this isn't just a numbers on a spreadsheet problem. Real people, families, seniors, children are being told, sorry, we can't take you.
You know, before today, when it came to Trump and MAGA and all that, like the fuck around and find out, I was like, they get what they deserve, yeah. Until I just had this 40-year-old white male patient who works in the oil fields in eastern Kentucky. And he's had low back pain for about 2 weeks, right? And then all of a sudden he gets pain in his calf, and he's just like takes off at work at the oil field and like uses a massage gun, drilling his calf. And he says he like comes up his leg, his back doesn't really hurt. And I'm just like, this man has a DVT. And I'm just like, have you had any difficulties breathing? And he's like, yeah, I went to the ER. They gave me medication and said I was having a panic attack. And I was like, okay, did the medication work? He's like, kind of. But this morning I had another one. It was just difficulty breathing and I was coughing. So this man is experiencing pulmonary embolisms, baby pulmonary embolisms. He muscle gunned his calf, which means he broke up the DVT and it's just slowly sending little babies into the lungs. He's having baby pulmonary embolisms, right? And there's a big mama that's going to come behind those. And I don't know when that big mama is going to come. I don't know if it's in 24 hours, 48, 72, 96, but it's coming and he needs to be on DVT prophylaxis right now. So I call his primary care in eastern Kentucky. and there's no doctors in that clinic because the one doctor is on vacation and they have nothing but nurses, so they can't prescribe that DVT prophylaxis. So they say he needs to go to the hospital, and the nearest hospital is an hour away. So I have to send him there. And I don't know if he's going to make it.
Wow. Do you hear that? They are literally saying we can't afford to keep treating Medicaid patients. That means if you are poor, elderly, disabled, or even just hit by hard times, you might not have anywhere to go. That's insane in the richest country in the world.
Gavin Newsom is calling out Donald Trump for betraying rural hospitals and communities that overwhelmingly voted for Trump. He posted this article here saying another California county is losing its only hospital after feds refuse to step in. And he says, heartbreaking, Trump continues to betray rural Americans, this time closing the one and only hospital in a county that he won by nearly 2/3. Since this hospital is closing, people that are having issues in this town will now have to drive 40 minutes into a neighboring county for critical care. Additionally, 150 healthcare workers are going to lose their jobs because of this already resigning and seeking work elsewhere. The federal government is taking away this hospital's critical access designation, which is 40% of its overall revenue, a gap too large for them to fill, forcing them to close down. And get this, it's all happening because of a newly interpreted federal rule. It requires critical access hospitals to be at least 35 miles from the next closest hospital when traveling by main roads. I mean, how ridiculous is that? This hospital is only 32 miles away, so it's 3 miles short of the required distance.
And here is where it gets even darker. These cuts don't just affect people on Medicaid. When hospitals shut down, everyone in that community loses access to care. Pregnant mothers, no maternity ward, people in accidents, no emergency room nearby. It's like cutting the lifeboat on a sinking ship and then saying, don't worry, it's all part of the plan. Like, what?
Okay, just found out this afternoon that the nursing home that my dad is in is ending their Medicaid contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts.
So it's because of the big, beautiful bill. I'm going to save you the trouble of going through a deep dive. That's why this is happening. Because I don't think people realize that 65% of nursing home residents are covered by Medicaid. So what did y'all think was going to happen when Congress just passed the big, beautiful bill and Donald Trump signed it into law, which had nearly $1 trillion worth of Medicaid funding cuts in it? I mean, it's going to shift the burden of cost over to the states, and a lot of states are not going to be able to eat that cost without jacking up taxes or cutting other benefits, so they're going to cut Medicaid funding. And nursing homes have to respond to that. So the way they're going to respond is a couple of ways. One is they're going to just restrict the amount of Medicaid patients they accept into their facilities. Two is that they're just going to boot out already existing Medicaid patients to open up those beds for private pay patients so that they can still make money. Or they're just going to shut down entirely because they can't function without that Medicaid funding. Any of those scenarios is just going to be devastating to the vulnerable patient population that requires skilled nursing facilities for care. Those are elderly patients and disabled patients. And what's going to happen to those patients? You can't just throw them out on the street. A lot of them are just going to have to go back home and live with their families, who are going to have to figure out how to make that work, how to provide the skilled nursing care that they were getting at a nursing facility at home. A lot of patients who are in the hospital, who are ready for discharge, who would normally go to a nursing home, they're just going to be sitting in the hospital till we figure out a way to get them home safely. And that's going to cause a lot of delays in care because it's going to cause backup in the hospital, and patients are going to be waiting in the emergency room, and emergency room waits are going to be longer and longer because the hospital just can't discharge patients because they have nowhere to go.
This right here is what makes it personal. It's not about politics anymore. It's about people being denied the care they need to survive. And when they are turned away, where are they supposed to go? Drive 2 hours to the next hospital, hope someone can afford private insurance? That's not realistic for millions of Americans. And here's the irony. They called it the big, beautiful bill. But tell me, what's so beautiful about cutting off seniors from nursing homes? What's beautiful about telling a sick child their clinic won't see them anymore? That's not beautiful. That's brutal. This is the kind of thing that people thought could never happen in America. And yet, Here we are, rolling back healthcare in 2025 like it's some dystopian movie plot. So I want to hear from you. Have you seen or experienced any of these shutdowns in your community? Do you think this is just the beginning, or can things actually turn around? Drop your thoughts in the comments. And of course, don't forget to like, subscribe, and share this video, because this is a conversation a lot more people need to have. So YouTube thinks you like this video over here. Thank you so much for watching. See you in the next one. Over.